This is a video about how to use the Asmanex Twisthealer 110 micrograms, a prescription medicine for the maintenance treatment of asthma for children aged 4 to 11. It doesn't replace your child's rescue inhaler for sudden symptoms, and it is not for children under the age of 4. This video will explain what makes Asmanex different and the step-by-step instructions about how to use Asmanex. Asmanex 110 micrograms is a medicine that children aged 4 to 11 take just once a day in the evening to help them breathe easier, in addition to using a rescue inhaler for sudden symptoms. It's helpful to understand what makes Asmanex different. The Asmanex Twisthealer does not require a spacer or nebulizer. Parents and children do not have to pump or prime the Asmanex Twisthealer before use. Just twist off the cap and it is ready to deliver the correct dose every time. Asmanex is breath activated. That means your child does not have to coordinate using his or her hands on the inhaler when they take a fast, deep breath. You'll see what we mean in a few minutes when we explain how to use Asmanex. Asmanex has a built-in dosage counter to help you know when it is time for a refill. When you first remove the inhaler from its foil pouch, write the date on the label. Throw away the inhaler 45 days after the start date, or when the dose counter reads 00, which means the final dose has been inhaled, whichever comes first. Now let's go through the steps you should follow each time you give your child a dose from their Asmanex Twisthealer. The first is step 1, open inhaler. Hold the inhaler straight up with the colored portion, called the base, on the bottom. It is important that you remove the cap from the Twisthealer while it is in this upright position to make sure you get the right amount of medicine with each dose. Holding the colored base, twist the cap in a counterclockwise direction to remove it. As you lift off the cap, the dose counter on the base will count down by 1. When you remove the cap, it is important to note that the indented arrow on the white portion of the inhaler is pointing to the dose counter. Now you are ready for step 2, inhale dose. Start by asking your child to breathe out fully. Then bring the Twisthealer to your child's mouth with the mouthpiece facing towards your child. Place the inhaler in your child's mouth, holding it in a horizontal position. Ask your child to firmly close his or her lips around the mouthpiece and take a fast, deep breath. Do not cover the ventilation holes while your child is inhaling. Remove the Twisthealer from your child's mouth and ask him or her to hold their breath for approximately 10 seconds, or as long as they comfortably can. Do not breathe out into the inhaler. Do not take or give extra doses unless your child's healthcare provider has told you to. Your child should rinse their mouth after using the Asmanex Twisthealer. After your child has used the inhaler, wipe the mouthpiece dry if needed, and then replace the cap, firmly closing the Twisthealer right away. The indented arrow should line up with the dose counter. Put the cap back on the inhaler and turn it in a clockwise direction as you gently press down. You'll hear a click to let you know the cap is fully closed. This is the only way to be sure that your next dose is loaded the right way. And it is important to replace the cap after each inhalation to protect the inhaler from moisture. It is important that you repeat steps 1 and 2 each time your child inhales. Please see the patient's instructions for use in the prescribing information for Asmanex for more information. Asmanex Twisthealer is approved for the maintenance treatment of asthma in patients 4 years of age and older. Asmanex Twisthealer will not relieve sudden asthma symptoms and is not for children under the age of 4. Asmanex Twisthealer is available in 2 dose strengths, 110 micrograms for children 4 to 11 years old, and 220 micrograms for patients aged 12 and older. Important safety information. Asmanex Twistaler mometasone furoate inhalation powder is not a rescue inhaler and should not be used to treat sudden asthma symptoms. Use a rescue inhaler to relieve sudden asthma symptoms. Asmanex should not be used to treat acute asthma episodes, including status asthmaticus, where extra measures are required. Asmanex is not for patients who have a hypersensitivity, including allergic reactions, to mometasone or any of the ingredients in Asmanex. There have been cases of hypersensitivity, allergic reactions, facial swelling, hives, and throat tightness reported. Patients who use inhaled steroid medicines for asthma may develop a fungal infection of the mouth and throat. Rinse your mouth after using Asmanex. It is possible that hypercorticism, an excess level of steroids in your body, or adrenal insufficiency, your adrenal gland cannot produce enough steroids, may appear in a small number of patients, particularly when Asmanex is administered at higher than recommended doses over prolonged periods of time. If such effects occur, consult your healthcare provider, as the dosage of Asmanex should be reduced slowly. If you or your child took steroids by mouth and are having them decreased or are being switched to Asmanex, you should be followed closely by your healthcare provider, and the oral steroids should be reduced slowly. Deaths due to adrenal insufficiency have occurred during and after switching from oral steroids to inhaled steroids. Tell your healthcare provider right away about any symptoms such as feeling tired or exhausted, weakness, nausea, vomiting, or symptoms of low blood pressure, such as dizziness or faintness. If you or your child is under stress, such as with surgery, after surgery, or trauma, you may need steroids by mouth again. Avoid coming in contact with measles, chickenpox virus, tuberculosis, or any other infections before or while using Asmanex. Contact your healthcare provider immediately if you or your child has been exposed. Patients who use inhaled steroids, including Asmanex, for a long time may have an increased risk of decreased bone mass, which can affect bone strength. Patients who are at increased risk of decreased bone mass should be monitored. Inhaled steroids, including Asmanex, may cause a reduction in growth velocity when administered to pediatric patients. The long-term effect on final adult height is unknown. Healthcare providers should closely follow the growth of children and adolescents taking corticosteroids by any route and reduce each patient's dose to the lowest dose that effectively controls his/her symptoms. Asmanex may increase the risk of some eye problems, such as cataracts, glaucoma, and increased intraocular pressure. Patients with a change in vision or a history of eye problems should be monitored by their healthcare provider. Use Asmanex as directed by your healthcare provider, since its ability to work in your lungs depends on regular use. Maximum benefit may take 1 to 2 weeks or longer. If your asthma symptoms do not improve or get worse, contact your healthcare provider. The most common side effects with Asmanex in patients 4 to 11 years old include fever, allergic rhinitis, abdominal pain, vomiting, urinary tract infection, and bruise. The most common side effects with Asmanex in patients greater than or equal to 12 years old include headache, allergic rhinitis, sore throat, and upper respiratory infection. Please see accompanying additional important product information. You are encouraged to report negative side effects of prescription drugs to the FDA. Visit www.fda.gov/medwatch or call 1-800-FDA-1088.